What's the best way to deal with anxiety caused by TRT?
TRT does not cause anxiety unless you're an anxious person to begin with and you believe that TRT is a reason to be anxious. Remember, depression is dwelling on the past and anxiety is dwelling on fear of the future. And if you fear something, you're going to be anxious. There's no direct mechanism by which properly administered, key term, properly administered and managed, TRT increases anxiety. Low testosterone can lead to anxiety because it actually reduces confidence levels. And when we don't feel well, our hope for the future, our outlook is diminished. And that increases anxiety. Because remember, I said anxiety is fear of the future. And if your future looks grim, you're going to be anxious. If your future looks bright, your anxiety is reduced. But if you're a type of person who anticipates things, expects things that are unrealistic, and then they don't occur, that leads to, again, hopelessness for the future because you have failed to meet expectations. That could lead to anxiety. So setting correct expectations with a patient up front is a provider's responsibility, but the patient's responsibility is to accept that and not think that TRT is going to fix every problem in their life.